Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the first video of repeat revision course of oral and maxillofacial surgery, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about third molar impaction classification, which is very important for MCQs. And in third molar impaction classification we will discuss three classification. First, according to angulation, mean the third molar impaction which make angle with the second molar, which type of angle, and second is the relationship of the impacted third molar with the interior border of the ramus, and third is the relationship of impacted third molar with the occlusal plane, or with the, we also says, with the second molar, mean compared with the level of the second molar. Now in first classification is according to angulation. According to angulation, compare the long axis of the impacted tooth with the long axis of the second molar. Here we compare the long axis of the impacted tooth with the long axis of the second molar. It also provides some information about difficulty of extraction, how much extraction is difficult. Now according to angulation there are four types. Number one is the mesioangular. Look at diagram, the mesioangular. The long axis of the third molar, impacted third molar, is directed toward the second molar, mean because second molar is mesial to third molar and the long axis of the third molar is directed mesially toward the second molar. This is known as mesioangular. It is the most common and easiest impaction. It is most common and easiest impaction because there is no ramus bone on the occlusal surface of the tooth. Second is the horizontal. Look at horizontal. The tooth is horizontally placed. The long axis of the third molar, mean impacted third molar, is perpendicular to the second molar. Look at the diagram, perpendicular. There is a 90 angle. It is more difficult to remove. The third is the vertical. The long axis of the impacted tooth run parallel to the long axis of the second molar, mean there is a zero angle, parallel. It is also more difficult. Next is the distoangular. The long axis of the third molar is directed distally or away from the second molar. Most difficult one, the most difficult of all angulation classification is the distoangular. Why? More difficult one to remove. Why? Because the occlusal surface is usually embedded in the ramus submandible and require significant bone removal for extraction. And this is the MCQ's point. Distoangular is the most difficult one. Now come to the second classification, the relationship to the relationship of the impacted third molar to the interior border of the ramus. Based on the amount of impacted tooth covered with the bone of the mandibular ramus, there are three class 1, class 2, class 3. In class 1, mean how much the impacted bone is impacted tooth is covered by ramus bone. The amount of bone we classify into three: class 1, class 2, class 3. Class 1, the crown is completely anterior to the interior border of the ramus, mean the crown is completely anterior to the interior border of the ramus, and it is the easiest one. Second is the class 2. Half of the crown is covered by the ramus. Half of the crown is covered by the ramus, and this is the class 2, and it is the more difficult. Third is the class 3. Tooth is located completely within the ramus. This is the most difficult one. Or also we can classify this in class 1, the distance between interior border of ramus and second molar is sufficient, and in class 2 The distance between second molar and anterior border of ramus is less, and in class 3 the distance between anterior border of ramus and between second molar is very less. We can again classify by this method. In this method there are two: one by how much the bone cover the ramus, second the distance between anterior border of ramus and second molar. Next classification is relationship to the occlusal plane. Depend upon the impacted tooth compared with the level of the second molar. Again, class 1, class 2, class 3. In class 1, the occlusal plane of the impacted tooth is at the same level as the occlusal plane of the second molar, and it is the easiest one. Second, the class B, the occlusal plane of the impacted tooth is between occlusal plane and cervical line of the second molar. The cervical line which divide the crown and root, it is more difficult. And class C is that the occlusal plane of the impacted tooth is below the cervical line of the second molar, and it is the most difficult one. And you should remember all these three classification: according to angulation, mesioangular, horizontal, vertical, distoangular, and relationship with the anterior border of the ramus. On the basis of space and on the basis of bone cover, there is a class 1, class 2, class 3. And third, relationship to the occlusal plane, all with a level or comparison with the level of the second molar. Again, class 1, class 2, class 3. This is all about impacted third molar classification. Now, if you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.